Perfect. So we're live there now. If you would like.
Just in light of, we may have missed that and the importance of the presentations this afternoon, I'll just repeat that because we had some technical difficulties. So we are pleased to present two Queen's Platinum Jubilee medals to two residents of Victoria County this afternoon. So I wanted to provide a little background on the Queen's Platinum Jubilee medal. The Queen's Platinum Jubilee Medal, Nova Scotia, was created in 2022 by an order in council and letters patented under the Great Seal of the province, approved by His Honor Arthur J. LeBlanc, Lieutenant Governor of Nova Scotia, representative of the Queen in this province. The medal is being awarded to 5,000 deserving Nova Scotians through collaboration with MLAs, Canadian Armed Forces, Protective Services, and provincial partners to ensure equitable representation of all regions and all fields of endeavor. The Platinum Jubilee is a tangible way to publicly acknowledge the work and dedication of those who are actively contributing to our province and our country. So I'd like to turn it over to CAO Leanne McCacken to present the medals to the recipients here this afternoon. So, and I'll also ask you to introduce the recipients as well.
Yeah, sure. Thank you. So we were contacted by the province and to put in some applications for names for the Queen's Platinum Jubilee for any members of our municipal workforce that went over and above during COVID and during the pandemic. So two names came to mind very quickly. So I just want to give a little bit of an update or a little bit related to our first recipient. So Lyle Donovan has been a dedicated EMO, fire chief, and several other different hats for EMO for the municipality over the last several years. Lyle, as everyone knows, goes over and above for the safety of our residents and did especially so during COVID, but we don't diminish anything that he does for for our needs these days also, now that we're a little bit past COVID. So, or I guess in the middle of it. Our first recipient is Lyle Donovan. So our second recipient is our Senior Safety Officer, Cassandra Yonder. So during the pandemic, Cassandra ran several programs which helped to keep our seniors fed, informed, and safe throughout the county. So our second recipient is Cassandra Yonder.
Thank you, Leanne and Lyle and Cassandra. We, on behalf of council and on behalf of all the residents of Victoria County, we want to acknowledge and congratulate you for being recipients of this very special medal. So again, thank you very much to your contribution to the municipality. Thank you. And welcome to those that are attending this afternoon to take in the presentation. So welcome to council. Glad that you had an opportunity to come up and see the medals being presented. So we're going to move on to our next item, and it's a presentation from EHS, and Eldon McDonald is going to come forward, and I know you have some representatives from EHS with you as well, Eldon. I'll let you explain or introduce them if they're part of the presentation, or if not, please introduce them, and we welcome all three of you to council and to Victoria County this afternoon. So if you want to introduce them and then take the appropriate seat, that would be great.
Thank you very much for the opportunity. Your last question, I can't answer, so we'll have that. First gentleman here is Mike Hillis. Mike is district operator supervisor of Northeast. And the other gentleman here beside him, in the operator, is Troy Bennett. Troy is a district operator supervisor. So you actually have to hear that.
Very good.
Where's the best place for us to walk in?
Right here.
That's mine.
While you folks are setting up, I just want to ask either one of the recipients if they have anything they wish to say or wish to.
Just to say that I really enjoyed working here in this municipality, appreciate my colleagues, and to be recognized by you means more to me than all.
Thank you.
First of all, I'd like to thank you all for the recognition. As you know, I love what I do, including these guys over here. They know I'm dedicated, so I'll just continue to do that. Thank you very much.
Thank you. So Eldon, that's going to be a hard act to follow, that your co-worker has received, he's received the medal. So anyway, having said that, not to put you under too much pressure, but we'll turn it over to you and you proceed your presentation. And if you're comfortable, we'll take questions after or during. That'll be up to you.
If something burning, you want to ask it while we're
And we've allocated around 20-25 minutes and we can go over if necessary. But just so you know that we do. Okay, thanks. We'll turn it over to you. Thanks. If you have a green light, sometimes we get a dead mic. We'll get you another one. One moment, please.
That's perfect. Thank you very much. There, that's better, is it? Perfect. So the whole purpose of us doing this was just to, I guess, as we discussed here in the last meeting is where the idea came from, was just to give an idea of what we do. Because I got the impression that when we met here last that, you know, perhaps there's more work we can do to inform the public on what goes on, right? I know that we know what we're doing. Certainly Lyle and the folks that are on the ground working every single day, they know what they're doing. Like Norm, you're the same way. But the public, I think sometimes is, we've made so many changes over the last 20 years that it's very hard for the public to keep up. No longer are we responding from a funeral home to pick up somebody who fell on the side of the road. It's a much different organization. So we'll run through it very quickly. I know you only have 20 minutes, so I'll run through very quickly. And at the end of it, any questions, the three of us are more than happy to answer whatever questions you have, and or any concerns even you want to bring forward. So the Eastern region is the area we're responsible for. It starts in Antigonish and follows right through into Cape Breton. It's the exact mirror of Nova Scotia Health. And that was part of the reason why we aligned our regions to look this way. Early last January, we did it just to keep us in sync with Nova Scotia Health. And that's just we look on the eastern zone here. This is all our stations in the northeast side. And there's all our stations on the interstate zone. Just was written on the slide, EHS, we provide a 24-hour emergency response throughout the province of Nova Scotia. We have a fleet of ambulances, PTUs, MTSs, spear units, ECP medics, community paramedics, and of course our ops support vehicles, fixed wing and rotary aircraft. We have two helicopters and a fixed wing aircraft. We employ over 1,100, I think that number is actually higher than that, of highly skilled paramedics, medical communications officers, clinical transport operators, which is a new term for us. Clinical, the CTO, the transport operators are a new group we started hiring on last year. They're responsible for non-clinical transport. So we have medical pilots, nurses, physicians, and system support staff. In our comm center now, we have a physician 24 hours a day, as well as a nurse 24 hours a day, which has been a phenomenal asset to us, especially for the crews in the ground. Last year, we responded to over 200,000 requests for service. Many days, our team responded to well over 700 requests for service. And actually, I think our highest number ever recorded was the day after Fiona. And that was, the Saturday, that Saturday of that weekend was 795 requests for service. So just a quick blurb, what happens when you call 911 in an emergency? The call goes to PSAP. If it's a medical emergency, this call is transferred to the medical communication center. It's answered by a comms officer, and simultaneously paramedics are being sent to your location. Know your civic address. I guess when you're calling, know where you're calling from. It sounds, when we're sitting here, it sounds like it's a simple thing to think of, but when you're in a bit of a pinch in an emergency, that those things are, they seem to slip our minds, and they're constantly fighting that when they're in the comms center taking calls. What did I forget there? When calling from a landline, receives a data burst, yes, containing the civic address attached to your landline and phone number. Cell phone, not quite the same. They have to dig a bit more for that information.
Excuse me, Elder, with the cell phone, I had a situation a few years ago where it was in a parking lot at Tim Hortons.
Yes.
And I called 911. They called me back. So they couldn't verify the location from the cell phone, right? Do modern cell phones have more of a GPS location? Can you detect that?
They can triangulate, but I think it takes a bit more work to triangulate to get that information.
Yeah.
So
But
there is a
in
time
my
loss there.
situation, I phoned, reported it, and then they phoned me right back to get the exact location.
And if you didn't answer the phone, they would triangulate that and they would get to you, but it would just take that piece of time would be a bit of a factor.
Yeah.
So currently we have 3 paramedic levels in the province. There's a primary care paramedic. Sorry, 4. I can't even, I can't count. The second one is an intermediate care paramedic. The third is advanced care. And the fourth is critical care. We won't see a lot of critical care paramedics working on ground trucks. We have a few that these folks mainly work in hospitals and on life flight. There'll be a few on trucks in the central area. We have none, I don't believe, you guys can correct me, but we have none in the eastern zone. However, we do have, I will say, we look at this and we think, oh, the higher the better. And yes, depending on treatment, yes, the higher the better. The primary care paramedics are highly trained. They're very well skilled and they know what they're doing, right? They can't do everything that the ACPs can do, but they can, they make a difference and they arrive on scene. I'll just touch on ICP very quickly. We no longer train ICPs, and we haven't for many, many years. It was a bridging program at that time to try and get as many medics as we could to provide advanced life support, like running cardiac arrest, that sort of thing. We bridged a lot of that gap now with training for the PCP group and with the addition of many more ACPs. So we no longer train ICPs, however, they still are in our system. So when the paramedics arrive, they're going to ask a series of questions, starting with signs and symptoms. They're looking for that. They ask about allergies, medications, your past medical history, last oral intake, events leading up to the need to call. Sometimes people get very aggravated with that. They just want you to grab and run. when they arrive, the paramedics need to form an assessment to know how they're going to treat and where they're going to transport. We talked about it very briefly the last time we we're here, and we'll touch on it in a second. Even deciding where they're going to transport is a key decision they have to make. Yeah, time involved depends on the emergency at hand, of course. Assessment includes identifying a number of factors, and they'll make an informed decision with regards to the appropriateness of treatment on scene versus while transporting to an emergency room. So transport decision-making is, they're made by the paramedics based on patient presentation and location, capabilities of emergency departments in the proximity. If we are in, I'll pick on Straight Richmond Hospital. If we're handing Straight Richmond Hospital and, there's someone has presents with a CVA, we are not going to transport that patient to the Straight Richmond Hospital because they need to go to a definitive care. So that patient will go right straight through to St. Martha's, where they can treat a stroke. Paramedics will decide on the appropriate mode of transport, be it code 1, that's lights and sirens, which is reserved for time-sensitive emergencies, or code 2, which is no lights and sirens. This mode of transport does not mean the emergency is not being taken seriously or is not significant. It simply means that the response was the most appropriate. There's lots of decisions, lots of thinking goes into making your mind up if you're going to travel lights and siren or not. You increase the risk whenever you turn the lights and siren on and travel faster on the highway. You increase the risk to the paramedics, the public, and the patient as well, right? So that's all made with lots of thought in mind. And the paramedics can change their mode of transport anytime during transport. That means they can downgrade or they can upgrade as well. I'm going to touch on this very, very briefly. It's the Canadian Triage Acuity Score. This is used when we're calling into hospitals. When you get to a hospital, especially, we hear lots of talk about offload delay. So when you come into an ER, you are scored. You're given a triage score based on this criteria here. So the most urgent, of course, is CTAS 1, and nobody ever wants to be a CTAS 1, but they're the most urgent. They're going to receive the care the fastest. Of course, it goes down the line 2, 3, 4s, and 5s. Your 3, 4s, and 5s are always going to be a bit longer of a wait if there's any kind of a hold in the ER whatsoever. Your 1s and 2s are ones are going to receive the care the fastest, and that's coming by ambulance or walking in off the street. Those folks need care and need quickly. I'm sorry, I'm not trying to rush
Can I
this,
ask a
folks.
question there?
Yes, absolutely.
So if I'm a CTAS 5 and I'm arriving by ambulance, I'm going to be assessed last, or I'm going to be scored as a 5. So does that mean means paramedics have to sit there with me while you're waiting?
Not necessarily. So we started there's 2 programs in play now. One is called Direct to Chairs, and one is called Direct to Triage. Direct to Chairs, when we arrive at the hospital with you and you're a CTAS 5, if it's appropriate, if you have all your faculties and you're able to take care of yourself, whatever, or there's somebody with you, then the nurse and the paramedic can make a decision. The triage nurse and the paramedic will make a decision to place you in chairs, which is out in the waiting room. The other piece of that is Direct to Triage, where we arrive. We make the decision prior to arrival to the hospital. Say this person is fine, they meet criteria. And a CTAS 5, unless you have something else that's resting with you that wouldn't allow you to be by yourself, we would take and place you into chairs in the waiting room and give a report to the nurse. So we wouldn't necessarily have to stay with you. However, if you had some other pre-existing condition that would prohibit you from being left alone in that regard, then yes, we would sit with you in offload delay. Yeah, absolutely. No worries at all. Yeah, I'll just, I keep saying, yes, I'll send emails, and she's over there. Yeah, sure you will. Yeah. We tried to send this to Steph, and it bounced back to us. But
So with the 1 to 5, and so is there a cutoff, like a 3, you stay, a 4, you can kind of evaluate and decide whether or not, and 5, you could leave if you so decide, like,
very
or is
good
it
point.
just everyone is?
Very good point. So we are looking at alternative transport. At this point, we have no choice. Sometimes we have calls stacked, as high as 30 calls being stacked provincially, like emergency calls that are being stacked. We just have no resources to send to them. So when you come across these calls, we are working towards a program where we can say, hey, okay, you can stay here. right? We can arrange transport. And we are doing that now in some cases with in consultation with the physician in the comm center. So we have these SPEAR units, which is a single person response unit will arrive on scene. And someone with low acuity, they'll say, okay, you need to be transported, you need to be seen, but we're gonna earmark you for transport, and I'm gonna leave now because you're okay here by yourself. I'm gonna leave and I'm gonna go to another call. And what happens at that point, and this is where the nurses coming in very handy at the comm center along with the physician, is they'll make callbacks. I believe it's every 40 minutes until they're picked up. We'll have a callback, and it's a very good point. And we're very cautious saying that because we're not quite there yet where we're going to say, you're not coming with us, whatever, right? Because every situation needs to be taken, into consideration under its own merit, because everyone is different. Absolutely. Yes.
This is going on for years. There you go, Jack. Been hearing this for years, hospital delays and that the ambulances are all tied up at the hospital. So it's been going on for years. Why haven't we increased the number of ambulances? If that's the issue, it's one thing to say you're stuck there, but why don't we increase the number of ambulances in the area to look after it, I guess, to give more supply of ambulances? Now, I know you just put another 100 into service, I believe, but from what I'm hearing, that was just replacing ambulances that were breaking down and whatnot. But is there any thoughts of increasing the number of ambulances, or like, how is that being addressed, I guess?
So I'll touch on that 100 part.
Okay.
That 100 people that were at it were not, they're not paramedics.
Yeah.
And they weren't put into, they're the CTOs, the TOs we're talking about earlier.
Okay.
They're the folks that are handling the transfers, the non-clinical transports for us, which I will say, SSP trucks, the trucks with paramedics in them, we're handling 83%, I believe. I don't quote me on the numbers, 80-some% of the transfer volume.
Right.
And now we're down to what, Troy? I believe it's less than 20% of the transfers are being. So the addition of those folks, critical, wonderful, absolutely is kept on the road. Touching your point about adding more ambulances to avoid offload, I would argue that, and please don't fire something at me when I say this, I'd argue that I wouldn't say we don't need any more ambulances. We'll certainly take whatever we can get. I think we need to recognize where some of that blockade comes from, and that comes from when we arrive at the hospital, right? I think if there was attention paid, there's a whole myriad of things we can look at, right? It's arrival at hospital and having the space at the hospital to have those patients offloaded and treated, assessed, and whatever else. That's part of it. The other part of it is having that consistent healthcare throughout someone's condition or life. Even when someone has a primary physician, they can go and see them. They can go have these things taken care of. A lot of times, the transport we're looking at now is folks that don't have that, or folks who have reduced access to it or can't get into the doctor, and it's falling back on the emergency service to have them transport it. The argument was made years ago to me, if we add more trucks, they're just going to get tied up at the hospital. I didn't see it then. I see it now more than I did then.
Yeah.
But I think that, I'm not saying that's not out of the case, not out of the realm of reasonableness to have more trucks at it. Absolutely. But I think we have to look at it from a broader perspective, is that, increasing access to healthcare for all Nova Scotians to avoid that trip to the ER. And the other piece is, in the ERs, the staff at the ERs are tremendously overworked and overstressed. They're pushing themselves. And we have to remember that all those folks that work in the ER, as well as the paramedics, work under a license. They work under a college, which they are responsible to. It doesn't matter what was going on that day. If something happens under their watch, they have to answer to their college for what happened, regardless of what the situation was. And it puts a lot of stress on the paramedics and puts a pile of stress on the nursing staff as well, because they're accountable for what they take on, as far as workload goes.
The other thing with the ones that do the transport, we don't see them in the rural areas. Like in Neils Harbor, for example, many a days our 2 trucks are gone and they're transporting patients or being called out of the area. Is there a reason that rural areas aren't seeing the transports, or is it only for the metro areas?
The medical transport, they mean the
Transferring someone from the hospital.
the transfer service, yeah. So I think, and I'm not going to make excuses for it at all, but when we started out, I think it's like when you're fighting a fire, you're going to go for the big flames first, right? And that's what we're hitting. We're hitting those big flames first. As we move forward, we're starting to look at other areas, smaller areas. And we just had a conversation here the other week, and we are looking at areas considering places like Inverness and those sorts of areas, right? So if we have placement of a transfer unit there, then those units would spread out into areas like Shetty to take some of those calls off, whatever. If we had something here in Badek at some point, then undoubtedly they would travel up to the Highlands. Is where that call volume is, though, right? It's a stationary resource somewhere where the call volume is very, very low, especially for a transfer service. It kind of, the resource is better allocated somewhere else, I guess, in some regards.
Okay, thank you.
Especially I know we're getting close to a 20-minute mark. I apologize. I'll talk faster. So we have some specialty programs, which I'm going to butcher going through it, but these lads can get me back on track. Life Flight, of course, we consider it a specialty program. Right now, they provide critical care to ill and injured patients, immediate clinical expertise, decision-making support, and safe, timely transport via rotary wing or fixed wing ground ambulance. They're not, apart from the emergency work they do, now we're looking at them giving some relief to us as well when we have long transfers between, say, Halifax and Cape Breton. Even if they have their peak team on during the day, which is their extra team is on during the day, oftentimes we'll utilize them to run some a transfer or 2 transfers back to Cape Breton, taking that load off the SSP units. But of course, we never do that unless there is a contingency there to fire to emergencies, right? So. And I will point out that our Life Flight team services Nova Scotia, but we also take requests from surrounding provinces as well for help when needed. Extended care paramedics. Troy, you want to talk on the extended care paramedic program? Because I will completely demolish it if I start talking.
Yep, no, absolutely. So the extended care paramedic, it started in Halifax and kind of branched to Sydney. We kind of merged it to a community paramedic. And these are the people that are going to the homes, doing assessments or doing follow-ups for the physicians so that we can release them from the hospital earlier. And sometimes when the VON is a new patient, it takes them 3 to 4 days before the VON actually gets the proper paperwork. So we'll bridge that gap for 3 or 4 days with the community paramedic and extended care. So our goal is not to replace, it's just to work together. So if we can release them from the hospital 3 or 4 days earlier, that frees up beds for people that need them inside. And that's the bottleneck that Eldon's referring to with the offload. So, I mean, if we can free up beds, that means people from Emerge can go upstairs and we can get the beds. So it's an advanced care scope with lots of extras. So antibiotics, suture removal, they'll do consult with the physician. So it's a busy program. They're into the nursing homes now. So anytime a nursing call, we partner with them, and if there's a fall or an assessment, the community paramedic or extended care paramedic will go and assess and consult with the physician. Our goal is not to take everybody to the hospital, take the ones that need it, and that's what this program is doing. So, yeah.
Thank you, Troy. I'll just skip over the parts that he just talked about. EPSO program. The title is off-putting. I have a T-shirt was given to me, and it has the title on it. It's the Emergency Preparedness Special Operations something. I'm in the business. What is emergent? Anyway, these folks are a specialty group of paramedics that have been selected to respond to a litany of very emergencies, including remote response, biohazards, that sort of thing. I wonder if I have that in a slide here just before I go any further. Yeah, there we are. Mass casualty incidents, confined space rescue, difficult extrications, and chemical biological emergencies. During COVID, these folks actually went on boats and went offshore and boarded vessels to do COVID testing with some people. And they have done some extractions from vessels as well and taken people back to land, I guess is the best way to describe it. They work very closely with our police forces, the special response teams, with the RCMP, with the Cape Breton Regional Police, with Halifax Police. When the police are responding to serve high-risk warrants and those types of things, things happen very quickly. And traditionally, we were on the sidelines just waiting for a call to drive how far to get to them. Our folks can be embedded with them. They're in a hot zone. They're not, but they may not be right in direct line of fire, but they are in that hot zone with the police when they're enforcing these warrants and that sort of thing, which gets care to anybody who's injured, whether it be the person that's being apprehended or the police themselves. The care is there for them in a much more timely manner, and these medics are highly skilled to provide that. Palliative care, the palliative care program. Paramedics will also assist with palliative emergencies and crises across Nova Scotia. As Troy just pointed out, our goal is not to drag everybody to the hospital. And if anybody here, I'm sure we all can point to family members who have been in palliative care. A trip to the hospital is devastating. It truly is. They're so vulnerable that when they arrive at the hospital, they're open to receiving any kind of infection that's sitting there in the hospital. We have successfully been able to send our trucks to palliative calls where we're able to treat people at home in conjunction with their orders, right, with their prescribed treatment, and to keep folks at home. And if needed, we transport them to a hospital as well. But they've been trained. Everybody's had the palliative from the PCPs right through to the ACPs, to manage these palliative calls at home. And again, having our doc now at the comm center and the nurse at the comm center has given us a broad range of support to be able to do that. Community relations. Every year, our paramedics spend a lot of their own time volunteering for various events. I took a picture today of our boardroom in Sydney, where the medics in Sydney, on their own time, their day off from their families, have gone and waited outside grocery stores, Walmart, to collect food and to collect toys for the less. And they do this every single year. They're not compensated for it. They do it on their own, out of their own volition, and they raise a pile of money, and a lot of it goes to a lot of good, like especially with the toys for children and stuff, right? I was blown away. I walked in, it was just a massive pile of toys, like Santa's sleigh blew up inside the boardroom, which it's awesome and certainly need it. They do visits to schools, parades, charitable events, presentations. Yes, that's a lie. This is the first one developed. Career days and much more. And maybe they had a presentation, just want to share it with us. That could be it, right? They just want to see us suffer. Where are we at here now? This is the move over policy. If you're traveling down the highway and you see a fire truck, a police car, an ambulance, or even a tow truck on the side of the road, the law is you slow down to 60 kilometers an hour as you go by them. I've been there. I know Lyle's been there, Normie been there, and certainly you two have been there. It's being on your hands and knees on the side of the road, trying to package somebody up and having people go by your ankles and by your feet, right? It's unnerving. It really is. And people sometimes just don't slow down. They don't think, right? So unfortunately, after some people have been killed, this law has been.
When you're meeting an ambulance or an ambulance is behind you, I'm sure you've had the situation where they don't see you and they continue. Can you report that incident? Like if I'm coming toward an ambulance and I don't pull over, I just keep going my 100 kilometers. Can you get my license plate number and if you get the license plate number, report that?
In Nova Scotia, it's hard now because we no longer have that front plate on
That's
the
right,
vehicle,
yeah.
right? So someone coming towards it, it's a little bit harder. If you're behind somebody that refuses to pull over, we can report that, absolutely. A lot of times though, like you just pointed out, it's the folks don't know you're there. They don't know you're there, or they're distracted, whatever the case may be. And oftentimes people see it, you can tell when they don't mean to do it because they pull over very quickly, whatever else, right? And our goal is not to, we're not out there to hurt people or slam them, right? So it's and that's why we have to be very cautious as well. And I preach this myself all the time. If you're behind somebody going cold and not pulling over, we can't get angry. We can't get angry because someone just may not hear you, right? Absolutely. So. Here we are at the end already. Questions?
Yeah, we do. And thank you very much for the overview. You probably answered some of the questions I already had, but we are going to start with questions. And I would just ask council if they would be a little brief with their questions and comments. Not that it's not important. It's just we want to make sure everybody gets an opportunity. So we're going to start with Councillor Longla, and maybe if you'll just let Eldon know your district. So
I'm District 4, Barbara Longva, from foot of Smoky to Seal Island Bridge and to the Alexander Graham Bell Museum and all inclusive in there. I just want to thank you for your presentation. You did answer lots of questions with the presentation. And as you said, you will email out
Yes.
the list from 1 to 5 of what's important and what's not. Anyway, thank you.
Councillor McNeil.
A personal situation in the last couple of weeks. We had an incident with our daughter and called 911. And the dispatch at the time, like it's a rural area, no real civic address where it happened. And basically, they kind of told us that we couldn't send anybody else out until we have a civic address. At the time, it was kind of, we gave them two rural roads that we knew about. But the ambulance was a little bit late getting there, but is like, especially in a rural area, when the civic addresses are so far behind, is there something that dispatch could recognize instead of giving that response that?
Yeah, so if there's a call comes in, we're going to respond to it.
Yeah.
Start that way towards it, right? Understand that we have to have some address to arrive at.
Yeah.
Right.
No.
But apart from a civic number, there's always the chance of someone to wait, flag someone down, that sort of thing is always an option. If that's the response you had from our comm center, we'll chat after this here and I'll take some information. We'll certainly track that down for you. Because what should have happened is once you made that phone call, someone was started towards that emergency. Or I'll be very honest with you, someone started towards the emergency or it was put in the queue for someone to start towards that emergency. Because oftentimes, as you folks well know, we're down to little or no trucks in an area, right? So.
And we do rely on the fire departments or first responders to help flag us down. Because people in the area would probably understand it, but this could be somebody from Glace Bay or Halifax responding. So we really look for the community to help us locate where we need to go.
Especially in rural areas too, right? When there's such a gap between civic addresses.
Absolutely.
That-
Yeah, and everything is recorded at the comm center. So like Ellen says, like if he gets the details, we can listen to it word for word to find out what happened.
And anytime that happens with anybody, we're more than happy I won't say hear those complaints, but to have that information brought forward. That's how we get better. If something's not working properly, if we're not doing something right, then we need to know about it so we can fix it. And we are accountable. Everybody who works, myself, Troy, Mike, we're all accountable for our actions and no one's any better than anybody else, right? So we'll follow through on that absolutely, Paul. We appreciate that.
Thank you for the presentation. I'm very happy that you're here. We can understand now how the organization works. And you get when you say the prevention will be if everybody have a family doctor. That way the ERs will be not too crowded. So that is how we are here in this mess because for all these years, the residents don't have any family doctors. So just thank you for coming, and if we can help in anything, just come to see us because really I know you are the front of this mess we have, and but if you have anything we can advocate for you guys and keep the conversation going because it's very important for our community, our EHS. So we appreciate what you do.
Thank you very much.
Thank
And I
you.
appreciate you saying that. And it's something that years ago, we all worked in silos. We look at the NSH, the Nova Scotia Health hospitals. And I know that, there's Lyle and Norm the same way. We go to a hospital and that was it. You got to the door, you dumped the patient out and you took off, right? That's their problem now at this point. It was always like nurses versus ambulance drivers back in those days or paramedics nowadays. Those silos need to go away. And now the same thing with communities. We need to be hand in hand with NSH, EHS does, but we also need to be hand in hand with communities as well. Because the only way we're going to get through this mess, as you said, that we're in, is by everybody working together and everybody understanding what everybody else does, right? So that monster in the room is not there. That invisible monster is no longer there, right? We identify the needs and where we need to work, and if by doing it together is how we're going to get through it. Absolutely, I appreciate that.
Councillor Patterson.
Warden, Fraser Patterson, I represent District 5, which is the Bulliedry part that's in Victoria County, Ross Ferry and Big Bedore. Just for the five of you here and all of your colleagues across the province, I'd just like to applaud you for the work you do every day. I've had a couple of incidents where I used the capability of an ambulance. And like you said, Eldon, we've come a long way from the old day when the taxi stand on the corner had a station wagon and that was the ambulance. So, I mean, we've gone leaps and bounds beyond that. So, and again, congratulations on the work you do. Keep up the good work.
Thank you.
Deputy Warden.
Thank you. Thanks so much, guys. I want to start by saying, I have the utmost respect for the paramedics that we deal with, and especially in Northern Cape Breton. I'm on the volunteer fire department. I've worked alongside a lot of them over the years, and nothing but respect for what you do. I can't do it. I would never be able to do it. I give you hats off for that. Back in 2005, the community north of Smoky got together and lobbied for special funding for a second ambulance in the Neels Harbor area north of Smoky. And we were successful in getting that. So now we have the second ambulance, but it totally disappears all the time. Are you guys aware of that special funding, and why is that ambulance actually being taken out where it was specially designed just for the north of Smoky area?
It's a good question. So there's 13 SSP zones within the province, and each one of those zones has been looked at by our comm center, of course, and they take all the data from years previous and look at it and see where we're going to break down, we're going to put our last truck, basically, right? So you go from your full complement of trucks down to your last truck, where we're going to put them. So that's how they break it down. So if there's, we'll just pick on, say, five trucks in one area, great. We'll have one here, one there, one here, one there, whatever.
Exactly.
As we drop down in numbers, those trucks go towards the most probable place for a call to come in.
Yep.
I understand that is very unnerving and unsettling, not just in this area, in a lot of areas. It is unnerving. Right now, that is the path we're following. I will say that our SSP is continuously under review, and right now is actually under review as well.
Okay.
Will we see changes in some areas? It's quite possible. We will see. I'm not going to promise those changes. I'm not. And we may see changes in some of those areas, especially the very, very remote areas where you could argue the fact that pulling them out is not as much of a benefit.
Exactly.
Currently, however, we are bound to the SSP that we're given to follow. And that's right down from government, right? It's our mandate to follow that SSP. Again, it's not that we want to take a resource away from an area, but right now we're being directed to point it towards the highest probability of a call.
Right.
That being said, and speaking about the community involvement, when communities speak up, people tend to listen, right? So, and I know that we've received some feedback from the community, especially the community north of Smoky.
Yeah.
We've received some feedback, and it is being certainly taken into consideration for sure. And I'm not trying to absorb all the someone said I'm the sin eater or whatever, but no, I'm not trying to eat all the sins here.
Yeah.
But it falls on us because we're the entity that's put in front of that.
Exactly.
Yeah, but we are looking at the SSP and right across the province and making changes that are going to get better for response. Because right now, let's be clear, our decisions on SSP were made 10 or more years ago. So, things have changed a lot in the last 10 years.
I understand, but again, I guess when the residents North Smoky fought for that special funding for that specific reason, it's not easy to swallow that ambulance, even though it's funded for us, we don't get to use it. I understand it has to go to busier areas and stuff. But again, yesterday in the North Smoky area, 14 hours, no ambulance in the area.
Right.
And that's not uncommon. I happen to be at the fire department quite often when the truck could be sitting there and no paramedics.
Right.
And I've also heard at times that there's paramedics. I've talked to someone and said, well, how come there's no paramedics? Well, I was off, but I would willing to come in an overtime, but I wasn't called. So it's kind of just unnerving to know that the ambulance is sitting there and there is people willing to work, but because of the cost, and I believe that goes back to the contract, and I think that's an issue the province has to look at to do that. The other thing is when our ambulance are pulled out, they go to Sydney, whatever, and they get there, and then they're kept there. Because like you said, it's the busiest area, and I totally understand that. But what is happening is rural areas are being left behind. A life in Northern Cape Breton is just as important as a life anywhere else. And to say, okay, these lives do not matter. I'm just being a little bit. The lives north of Smoky do not matter. We're going to take all the AMs, put them in the metro area because there's going to be more calls. It kind of makes it look like we're second-class citizens. And I'd like for you to take that back to the province. We're screeching about it all the time. But if you guys could bring those things back, and that it's not acceptable. We totally understand the issues with the hospitals and stuff like that. But the government's got to come to act here and do something. It's great to say we're a new government just came in. Well, they've been in a couple of years now. I've had enough of it. It's time for them to act and do something. More ambulances. But again, the rural areas, and we got that special ambulance for a reason because we're so rural. If I make a call and the ambulance is really closest one is Sydney or Badek, not doing us any good. They're not going to make it back there in time in most cases. So anyway, I have not but respect for you guys. If you could bring that back to your management and to the province, any chance you get, push on it, because I can tell you the residents north of Smoky are not happy, and pretty well right across the whole county and across the province. So, but anyway, thank you very much for the presentation. I do appreciate it.
No, and no disrespect taken whatsoever, and we appreciate the feedback, because that's how we move and go forward. I do want to point out one thing, though. When you pointed out about there's ambulances there that aren't staffed, I will challenge that. If we have not spared any expense on staffing units. The money we've spent in this last fiscal year alone on overtime is absolutely staggering. There's no limitations in overtime, none whatsoever. We've actually fought for an increase in the overtime rate for paramedics, which we weren't successful for getting for the full week, but we have it for, I believe, nine pay periods out of the week, or nine sections of the week as far as working section go, 9 reporting periods, I guess. Yeah, Wednesday through to Monday. So it's basically what it is. That would have been easier to say from the start, wouldn't it? Like, absolutely. So we have fought for that piece of compensation for the paramedics, which we did receive. But again, if there's paramedics willing to work and they are not going to be fatigued, or they're not infringing on the fatigue policy, we will put them into trucks. We will use them. If it is not happening, if that happens where someone does not get a call for a shift, or they're not taken into to staff a unit, then we want to know about it. And certainly from our medics, they can let us know and we will investigate it. We're not going to bring a medic in. I'll be honest with you. We're not going to bring one medic in to work in an ambulance in Ingonish with nobody else, because we can't safely deploy them to a call in Ingonish by themselves, right? However, if we can staff a truck, we will do it. Absolutely will. And, welcome that for, I know that Norm, you and Lyle listen as well. If you hear of some of your comrades that are saying that they're not getting those calls, we need to know about it, because we will definitely act on it, because there's somebody responsible for not calling people.
I will say, last year was really noticeable. In the last couple of months, I hadn't noticed this as much, but last year in particular, there was a number of cases, and I don't know, maybe there was nobody available, but it's hard to watch an ambulance sit there with no staff.
On a daily basis, and I'll tell you, coming to Christmas now.
Yeah.
People need time off. The medics have been working wide
Totally agree.
open. They've been trying to get vacation all year long and they're not getting it.
Exactly.
We had people come to us, hey, listen, I put in 40 requests for vacation and I got in 3 days.
Understand.
I mean, people can't continue to work that way. We've all been around animals growing up, right? You can flog a horse so long, it's going to stop working, right? You can't do it. So over Christmas, we've right now, even before Christmas, we're taking all the denied vacations. So vacations are approved or denied based on criteria. So once they're denied by scheduling, they come back to this group and they look at them. And since September, we have approved 56% of denied vacations. What we do to get that done, however, is we look and say, how many trucks can we drop? How low can we go in units? We don't want to drop any trucks. However, we can't keep pushing these people past their abilities, right?
Understand.
So from now, this point forward to the new year, over Christmas, we are down to, I won't say a skeleton crew, but we've had to approve so many vacations. We just can't keep pushing people, right? So we're down to a reduced number of units. So it's back to your point about trucks not being staffed. Yes, on a daily basis, there is a number of trucks in the province that aren't staffed, and the percentages sometimes can get very high. They absolutely can.
Oh, thank you very much. Appreciate it.
And no worries.
Jackie Organ, Counselor District 7 from North Ingonish, Niels Harbor, Small Brook, White Point, South Harbor area. Thank you for your service. Appreciate it. And I just want to say, Mr. Doffney here voiced all my concerns too for the North of Smoky area. So I will leave it at that. Thank you.
Thank you.
Thank you, Counselor. And we saved one of your colleagues to second last. So we're going to go to Norman and Counselor McDonald, and then we're coming to CAO. Then we come back here to wrap up. So Counselor McDonald.
Thank you, Warden. Thank you, gentlemen, for coming today to council. It's nice to see the responsibility that you've shown to finally take the initiative to come and present, which is something on my 6 years of council that was first time we've seen EHS come to the table. So I appreciate that. I know each of you on a personal level, and kind of hard to speak for my supervisor sitting at the table. So I'm a little intimidated, but I really don't have any questions. And I just thank you all for coming. That's it for me, sir.
Thank you, Norm. And we can assure you, Norman is very well behaved at council, and I'm sure he's the same way when he's working with you folks.
With a last name like McDonald, he couldn't be anything but good.
No, true gentleman. CAO.
He is, and yeah, with 2 paramedics in their spare time, I guess, doing work for the municipality. They are always at the top of our list for being concerned with their well-being and for all paramedics' well-being. Is there anything else? Is there more that can be done? Is there anything that council can do to help? Because there is still the backlog. So is there anything that council or the municipality can do to help, even with dealing with the province or anything related to any of these backlogs and the stress that's put on all of you, which we 100% appreciate and are behind trying to help make this better. So is there anything that we can do? Easy wins that we could help with? If there is, or if maybe you don't want to speak on that, but we welcome anybody to get us involved or speak to your counselor.
Recruitment would be great. Anybody that's interested in paramedicine, no matter from junior high to high school, like we'll mold them. We would hire as many people as we could physically get to make sure that the staff that we have a work-life balance. We want to make sure that the public's protected, but we have to make sure our staff are protected as well. And we hear your frustration, but if we can start to help with recruitment, it would be really grateful for us.
Well, what I can tell you is that we're planning on we're getting Cape Breton Partnership to host a job fair around the island I believe it's going to be in March. So we can be in contact with you because the county is putting a table in. So I would expect that paramedics would be also, but it's hard to or ask somebody to come work for you when you can't always say that it's the best place to work either if there's a lot of stresses there. So anyway, we will be hosting a job fair and we can let you know. One other thing, an area that is near and dear to me is any of the trauma that paramedics can face or PTSD from answering some of these calls. So I know from friends of mine who have since left the paramedicine in the Eastern Zone that there wasn't always the best coping with afterwards. Are you able to speak on that, if it's improved at all, or is there a process in place to help keep paramedics mentally healthy as well?
I think it's a multi-phased approach to it, like Troy just pointed out, having people the time to be home to unwind. We see it constantly. I mean, people that are always engaged, plugged in with no time to rest, burn out a lot faster. This stuff happens a whole lot quicker. I think one thing is beneficial right now. We have a greater realization of burnout and of things like PTSD and that sort of thing. However, I think that where we're failing is the resources available for people to access. And we see it frequently when we're referring people, and we have some folks that will, need service such as that. So they go through our health wellness, and we're looking for practitioners to actually help these people. Sometimes the waiting lists are rather long, and it's very, very unfortunate because some of these people need to have that intervention immediately, right? So in any part of healthcare, you've all heard about the social determinants of health. So if someone has that support at home, someone has that support within their friend group, their family, whatever, they're going to do much better. If we have the lone wolves that are out there, and we do have some folks that work for us that, they live a very solitary lifestyle. They provide a wonderful service, but they have a very solitary lifestyle and they don't have the same support when they're outside of work, right? So oftentimes those folks are made feel like they're just left hanging in the wind. And a lot of that comes back to the availability of resources that are there. I won't say that EMC is doing, or EHS is doing everything perfectly, because we need to keep growing. Everybody has to keep growing every program they have. But I will say the programs we have in place now are far ahead of where they were even 10 years ago. And we do have, I remember we had one person years ago working in health and wellness for the entire province. And now we have a massive team that's working that cannot fit enough hours into their day, right? So it's increasing problem. I know there's increasing awareness around it. And it's comforting to see people recognize it. Honestly, it is. I just think that even as a healthcare system, I think that we're, and not just for paramedics or for any other emergency responders, I think for people in general, I think perhaps healthcare could use a whole lot more of a boost to address the issues that are at hand. Absolutely.
Certainly appreciate everything that paramedics do for our communities. So, thank you. And I'll put my plug in for helping the helpers in Antigonish. So my buddy.
Thank you. Just a couple of quick things. And one, just to speak to community involvement, we had Lee Norman, who is an EMT here, paramedic here. He just, through EHS, has provided us with an AED down at Water Street. So it was, the community appreciates it. We appreciate it. And it just speaks to what you had mentioned. So I just wanted to mention that while you were here and acknowledge it was him that brought it forward to us. So
awesome.
we appreciate that. And The other thing I just echo, and I have a comment in the end that I need a little help on, but I, certainly want to echo the comments of everybody in the room. Your profession is highly respected, particularly in rural communities. Absolutely no question about it. You're the front line, you're the first responders, and we very much appreciate the service that you provide. I guess my question is, because the state of health care is in this province, a lot of people are frustrated by it. And I guess when I think of our local situation here with our hospital facility that we have, I guess I struggle with two things. We don't have an ER. We hope to get back to an ER. But in the meantime, you don't respond. You can't bring patients to the, right?
No, there's no emergency room service there.
Yeah.
It's a disservice to the patients.
Right. And I understand, and I know you do the assessment. I guess my concern is when we talk about the tying up of ambulances. And I'm very glad that you explained the 1, 2, 3, 4, 5 level of care. So if you have somebody that's a 4 or 5, that's not necessarily an emergency, do you have to take that person to Sydney and or Inverness, and that ties up an ambulance from the community? You know where I'm going with this, right?
Absolutely. And so, and we spoke of this earlier about, we're starting to dip our toe into that water of, hey, call the MCCP and say, what about making an appointment for this individual at the urgent treatment center? Can we do that? Do you feel this is warranted? What's the risk involved? And everything has a risk, right?
Yeah.
And is their licenses on the line, right? Is there,
Yeah.
they're signing this paper? So I get it, from that risk perspective, but you're right. Is there a need to drag that person who is a level 4 or a level 5?
Yeah.
Is there a need to drag them an hour and a half down the road to their facility, or drag them to Inverness where they're going to plug that ER up? Everybody loses in that case. So if it's not necessary, we are actually looking for other solutions for alternative transports. We really are for that. Again, we're not full blown into that yet. If we're dipping our toe in that water, it's everything is a slow process. It really is.
Yeah, and I think just because of the state we're in, everybody is, as you said earlier, everybody's starting to take a look at what can we do better and how can we work better collaboratively. So I'm pleased with that, because the other thing that you were very successful at today is provided some clarity about what your role is, because I think most people think that, a lot of people think that hospitals or ambulances are connected and run by hospitals or by the district health authority, and that is not the case. And those of us that have seen presentations and know certain information, we know that's not the case. But I think most people think it's just the two are connected a lot closer than they actually are. So with that, I just want to thank you very much I really appreciate you coming. You were very prompt in coming, and we do appreciate that, and addressing some of the concerns that were brought forward today and providing us with information that's beneficial for us that we can pass on to our community as well.
I hope the next time you see this presentation, it's improved. Like I said, it's our first one we put together, so we'll keep building on it as we go forward for sure.
Well, I can tell you that you don't have to tweak it very much. It was very good. So, yeah.
Well, we appreciate the partnership, and I mean that wholeheartedly. I mean, we can sit here and talk and pat each other in the back, and that's fine. But we mean it wholeheartedly. We appreciate the partnership with you people in your endeavors here within Victoria County. There's a lot of stress here with the closure of the ER.
Yep.
And I know there's a ton of work being done behind the scenes to do the best to get it open. I get it. But there's a lot of pressure here, and you folks are feeling, because you're the ones representing the people in the communities, whatever. So we appreciate the partnership with you, and by all means, we're happy to if you feel there's another need for a presentation with our community, whatever you folks feel, we're happy to respond to that as well.
Yeah, no, that's a point well taken. I can assure you, as the CAO has said, if there's any cooperation, anything you need from us to help promote the different programs, we're more than happy to do that. So,
well, keep the feedback coming to us and to government, whatever else, you know what I mean? That's open communication is how things get done, honestly.
yeah, no, and you're right too. We're not pointing fingers or blaming anybody if we don't work collaboratively, including municipalities and the district health authority and EHS and all the players. That it's going to continue, and we don't want to see that. We want to see improvement. So. Anyway,
Just
thank
a
you very
mo-
much.
Just
Yeah,
a yes or
sir.
no question, Warren, if you would. Are you permitted to participate in Take Our Kids to Work Day? Because I know some professions are not because of confidentiality and stuff like that.
Modifications, I know that some of our administrative sites have had it. Within our operational sites, it's really not advisable.
No, that's what I thought. Yeah, that's what I thought. It's too bad. Jake.
Yeah, it's just in the exposure for people. We have an issue even with our TOs we hire. We have a 2-week training program, we have concerns with them in emergency situations, so that's why they're not in them. Is that exposure to those emergencies can be traumatizing, and for someone coming in completely oblivious, it's it's just the risk for them is too high.
And most people think they know what to expect. And I can promise you, you don't. And that's, what we feel for our staff. People are here for, 4 or 5 years and they can't continue. We respect that because this is not normal. And what we do is not normal. But we respect the people that self-evaluate and step down because not everybody can continue. So,
All right, well, other than that, we just want to again acknowledge our recipients and acknowledge that one of them is a paramedic EMT. I'm not sure what the right terminology is, and he's both are well appreciated members of your organization, as is also Cassandra, a valued employee of our organization. So with that, we're going to take a 10-minute break, and thanks again for your time.
Thank you, folks.
Thank you very much, folks. We appreciate it.
So regarding that email, if it keeps bouncing back, CTAS, CTAS, if you look up CTAS, Canadian Trauma Duty Sport, look it up online. You'll get that exactly what I took up mine. CTAS, yep. I took that right off of the internet, that picture, but I will try to send it to staff as well.
We're online.
We're going to reconvene council. Next item on the agenda is the minutes from our November 28th meeting in Iona. Those minutes have been circulated to you. Were there any errors or omissions in the minutes? Everybody is satisfied with the minutes. We have a motion to approve the minutes of November 28th.
I move to approve the minutes of.
Moved by Councillor Longba, seconded by
Second.
Councillor McDonald. All in favor?
All right.
Contrary minded, motion's carried. Thank you. We're going to turn the next item over is the CAO's report.
Great, thanks. So you've all received my report. Just going to go over a few of the items on it, and if there's anything else that I'm not mentioning, you can be sure to bring it up. But we'll start with the municipal boundary review. So we've completed our municipal boundary review and we have submitted to the UARB. So we should hopefully hearing back from that in maybe late December, early January, hopefully. Our North Shore washrooms. So Kelly is taking the lead on this. The site has been scoped out and we're in talks with an engineer related to our meeting that we had at the end of October down there. Our UARB hearing on our water rates study was held on November 29th. We had 4 members of the UARB here. We had no public show up to it. We had only one undertaking related to that, which is questions that we weren't able to answer. So thank you to all the staff that helped work on that. Well done for everybody who helped out on the water rate study. Yeah. Well, we were hoping to have something by late December. Paul, your mic wasn't on it also. But they are unsure if they can get that to us by then. So they're thinking they're pushing hard, and based on only one undertaking, which we've now answered, we're hoping that we're going to move it through quicker, but we're unsure. So if we don't have it by the end of December, it will be January, and then we won't be able to send out the bills with the new rates until at the end of March, I think. Bruce, Warden, you had a question related to the Trans-Canada Trail sign down on Water Street. I was in contact with the village related to that in 2019, 2020. Revisited that with them because they had installed that sign. So we've contacted them. So it's in their hands to have it moved. Okay. We were talking in the past few months about an island mayor's wardens meeting. Seems like all the CAOs have gone back to their council and seem to be for island-wide. They seem to be interested in that and having it open to all council and First Nations. And we'll be coming up with possibly some potential dates in February. If everyone could keep me updated if there's anything that they couldn't do in February related to that. And we'll be looking for possible agenda items for that as well to come together with other municipalities. Also, just to let everyone know, the village is sending off a letter. The village of Bedeque is sending off a letter to the minister to convey ownership of the Bedeque Volunteer Fire Department property to the Bedeque Volunteer Fire Department. The village is sending the letter to the minister for approval. We don't need ministerial approval. We already had a motion done to convey that property at an earlier council session. So this is just for an FYI purpose. Couple of things related to some department head items. So in Public Works, we had an earlier meeting related to the changes that are coming up in C&D being pushed down by the Department of Environment. Huge changes, huge dollar amounts for the municipality. We're going to be getting some public information out there to keep everyone aware because it is major changes that are going to be happening if they go through, which we are not for, we are actually against. Kelly also sat in on an EPR meeting and we're learning about what we could accept related to recycling materials. It's not exactly still clear on how things will be collected. We are now accepting applications for depot donations for both bottle depots in Bedeck and New Haven. So if there's any organizations that are charities or not-for-profits that are looking to get their applications in to get donations from the bottle depots, please get that information into Kelly ASAP. Just a reminder that the ghost gear that the Coastal Action has collected has all been picked up. We are making good progress on our roof renos down at the Rec Society in Ganesh. Just a couple of things left outstanding on that. A couple of things in water. Our well pump has been replaced in Ganesh, and there's been a few repairs of water breaks in Ganesh. They all went really well last week. Department of Environment has also been down to Niels Harbor, the new treatment plant, and we'll be issuing our new permit soon. So it looks like at this point. We also have 2 of our operators that will be taking their class 2 tests this week. So we wish them well and good luck with those. We know that they'll do very well. Related to weather cancellations, which is probably happening tomorrow, related to collections. We are no longer going to be doing double days if there's a weather event. What we will be doing is we'll be leaving it and collecting on the following week on their regularly scheduled day. And we will be allowing for more material to be collected than the limit that we have in place if that's required. In tourism department, so we've had tourism members who attended the tie-ins conference, the tourism summit last week. Tourism is also working with, they hosted a meeting with Tourism Nova Scotia on compelling tourism communities, the emerging winter destination pilot project for Ganesh. So we're going to be hoping to be hearing some more things related to that. Related to the recreation department. So our recreation officer has been down. He's been working on some youth initiatives. Actually heard from a counselor that he visited the Cabot Education Center, and he talked to every class there for talking to the students about what types of recreation activities and sports they'd like to see within their community. So we're going to work on seeing what he gathers up and see what we can do related to that. He's also working on a multi-sport pilot program for grades 3 to 5. So more information should be coming out relating to that. He also attended a sport and recreation inclusion workshop. So I've asked if he can put some slides together related to inclusion and start to do some presentations to council and to staff members about inclusion in the workforce and in the community. And so we should be having a little bit more related to that as well. On the trails side, congratulations to Cabot Snowmobile Club on the arrival of their new groomer. And we're wishing all sledders many happy trails ahead for this winter. Hopefully there's lots of snow that comes down. We have no information yet related to the large Infrastructure Canada grant for trails, which we put in March of 2022. We're still waiting on that. Sometimes they can take an awful long time. However, after 3 years of preparation and applications work, we've received final approval of a COA funding for the next 2 sections of our trail development that we've been working on, as per getting approval of our area final report. So that's good news, and we'll be moving forward with some new sections of our trail. In community development, Bedeck Waterfront has held a successful community update meeting last week, and they have a new initiative called the Bedeck Beacon Comprehensive Community Plan, and there will be some planning happening with that over the next 12 to 16 months. We've also done a quick synopsis of all of our placemaking projects, and it looks like we've taken our first 5 projects that we've worked on. Looks like we've raised about $200,000 in funding from provincial and federal funding sources. And I think it's cost us about $25,000 right now related to that. So well done on our placemaking and community development team that we have working on that stuff. Senior safety. So senior safety is still working with the RCMP to deliver some frauds and scams presentations to seniors throughout the municipality. So they should be showing up at communities near you. Our she sent out her first senior safety weekly bulletin that was circulated last week. And the hope is to get those going out each Tuesday with some information. If you have some seniors who would be interested in getting that, it is an email blitz that we're doing right now. So if there's any that would like some information on that, they should get their email addresses into Cassandra and they can get added to the list. We also sent out, and the accessibility committee, which I think will be on the committee reports, but we sent out we have ready our final draft of our accessibility plan. It's been approved by the accessibility committee and it's ready to be approved by council. We also have been doing some recruitment for our Acting Collectively project. It's underway now. We hope to hear from any of our community members who are over 65 and willing to participate. Please reach out to Senior Safety on that to learn more also. A few other things. So I received a report back from our Director of IT. He tells me that related to the computer security training that all of you would have received an email on, staff and council, we were only about 29% complete. So all staff members and council that have not completed, please complete. If you need some information on finding it again, let us know and we can get it sent back out to you. What's that? We will, yes. You may have received an individual one, but we'll do another email out for those. That's a great idea, Perla. Yep. We will send that out. That's great. Related to the provincial Fiona relief program, just letting everyone know that that program is closing December 16th. So if anyone has not received their emergency provincial Fiona, I think it was $100 and $250. It's closing December 16th. I'm planning a meeting with admin staff to discuss next steps related to the courthouse. So we'll be reporting back to that sometime in January, February. I also have received an EMO report on EMO's meeting that they had with the province on a debrief of Fiona. Instead of having Lyle come back to council, he's already been here related to Fiona. I thought we'd just got him to do me a staff report. And so I'll be sending that out in the near future. I'm also thinking that I'm hoping we should set a date to do some strategic plan update sessions. Like to talk about the strategic plan of the municipality on a go-forward basis. Also like to add in, if we have you there, we'd like to do as many different things as we could, including governance updates and refreshers and possibly sneak in a little bit of preliminary budget and things there too. So hopefully in February or March, we'll be doing a strategic plan update session. And Bruce and I received an email from Jen Ripley related to Meals Plus. We had her present here in a couple of months ago related to Meals Plus. She is telling us that she's received requests for Meals Plus from community members who are not clients, but who could benefit. Victoria County Home Support Services would gladly facilitate and deliver the program for non-client residents of Victoria County should the municipality or individual councillors wish to cover the cost of food alone. She says the cost is $30 per delivery per person and delivery happens every other month. For 3 months, the cost will be approximately $180 per person, and they currently have capacity for 12 people, which I've calculated to be about $2,160 for the winter months of January to March is what they're thinking they'd be able to help us out with. It's a question if council would like to look into that or if that is something that would be of interest to them.
So when she appeared before council, we said that we would give it some, considerations. So these would be meals that would be available to people that would have that food distributed through Victoria
Home support.
Victoria County Home Support Services. So really our commitment would be $2,100.
Thank
And
you.
that's 12 people.
Question. I think she mentioned in that document too, a possibility of it coming from our district budgets.
Well, or we could, since it's 12, since it's across the municipality and it's 12, to me, $2,100, I would say it would just come out of our general coffers where it's not as significant if council wishes to do it. But I think there's lots of need out there and this may identify the need and it could be a program we could look at later. Plus it also addresses seniors or people that live alone. It's not always a monetary issue and they're a better judge and they would do the administrating of this project. So are we interested?
For information purpose, could we find out like what districts these 12 people were coming from?
Sure. And they'll have to figure out a way, whether they have a wait list or they already have people that may have signed up or expressed interest. So, yeah.
I'd like to make a motion that we proceed with the $2,100 to assist the program.
We have a seconder, seconded by Councillor Patterson, moved by the Deputy Warden. Any further discussion? All in favor? Contrary minded. So we'll ask Leanne to confirm with Jennifer Ripley that we are indeed like to be engaged in the pilot project. And it's a pilot project between now and the 1st of April. Thank you very much.
That's all I
Thank
have.
you. Any questions for the CAO in regards to the report? Councillor McNeil and then Councillor Patterson.
Yep. They happen on a certain day. Then we'll look into some other changes. Yeah, we'll look into it if it gets to be a habit. Yeah.
Good. Councillor Patterson.
Just a related question on Mondays too. I guess wrongly assumed when we didn't have collection on Monday, that it would be on Wednesday as it is when it's a holiday. What's the difference between a storm and a holiday?
Well, holiday, we send out a schedule ahead of time. So those days are actually scheduled to be that way.
Yes.
Yeah, so we know a holiday ahead of time, so we can schedule around it. But so that's because our staff are not scheduled for those days on that, during those extra hours. Yeah. Yeah,
A double collection,
yes,
and that's where they have to do two runs basically in the one day. is it?
yes,
Yeah, okay.
Yeah.
Yeah, no, people were just wondering, as long as they have an
yeah,
explanation.
for
I think they'll be
staffing
all right.
purposes and
Yep.
efficiency and
Okay,
cost.
thank you.
Thank you, Councillor. Any other questions? CAO? Thank you, Leanne, for your report. We're going to go on to district concerns to start with district number 8.
Yes, thank you, Warden. I had two pressing road issues, but I would like to thank Mr. McDonald who took care of them promptly and there's no other TIR issues right now within my area. And lastly, just not so much a district concern, I just want to give recognition to a local lady from District 8 in Cape North, whose name is Jade Wilkie. She just passed her paramedic provincial exam for the province and is actually working with emergency health services in Dartmouth. So I'd just like to send a appreciation from council to her. Congratulations. And that's it for District 8.
Thank you, and we will do that. Councillor Organ, anything from District 7?
A request for the no parking signs in White Point were sent to Mr. Bernie Murphy a while ago from Mr. McDonald. And he's going to follow it up again. This is an ongoing request and I've been working on this since May, so hopefully it'll be taken care of soon. And as for the street light at the intersection into the White Point, which I feel and the residents of White Point feel it's a safety issue. Department of Public Works does not maintain lights on local roads for that. So I will be putting a motion forward. Council Organ move that a street light be put at the intersection of the community of White Point, and I will be sending that request off to Steph tomorrow.
We have a seconder for that,
I'm
please.
sorry.
No problem.
Second, that's Warden.
Thank
Second
you.
by Councillor McDonald, all in favor? Contrary minded, motion's carried. Thank you, Jackie.
And I had an email about the transit bus and the importance of it in the north of Smoky area and was looking for updates on repairs. So I contacted the individual and told him that it was brought up in the transit meeting earlier today and that an update will be put on the website. Oh, sorry, on Facebook page. I'll correct that with her. Anyways, and that's it for me. Thank you.
Counselor, Deputy Warden Doffney.
Yes, thank you. First one, I want to make a motion that $500 from District 6, District 7, and District 8 be given. I'm going to have to get who's actually the check is made out to, but it's our EMC, Lyle Donovan, recently completed a presentation at the Cabot High School to all the students and glowing reports about it. I mean, the kids really realized the importance of closing your bedroom door and what to do during fires. I guess the impact of his presentation was amazing. I've heard nothing but praise for it. But part of his presentation was to give a fire detector to every member of the school. So between the fire departments and 3 counselors north, we're going to cover the cost of all those fire detectors. But it was amazing how many homes actually do not have a fire detector. So it was a great initiative, and I send out my congrats to Mr. Donovan for doing this for us. But I make that a motion.
We have a motion. Do we have a seconder, please? Second by Counselor Organ. All in favor? Aye. Contrary minded, motion is carried.
Second, I want to make a motion that a letter be sent to the Minister of Public Works, Kim Maslin, in regards to speed limits on side roads and gravel roads. Something I've come across the last couple of years is that if it's a gravel road or a side road, even if it's paved and there's no speed limit marked on it, then it's 80 kilometers an hour, which is not reasonable in a lot of locations. One instance is Harborview Road in Ingonish Beach, which is known as the Whitty Shore. This road, most cases, number of turns in it. It's supposed to be 2 lanes, but definitely not in the summer with the elephant ears that growing over it. It's a windy road. It in places is only about maybe 3 to 4 feet from homes. So, and there's young children at these homes. So what I'd like to do is make a request. The motion is that they review their policy on gravel and side roads. And the other thing is the residents of this road have been told that traffic study had to be done by Bernie Murphy, who I believe is an employee of Public Works. I've heard the name many times, never met the man. But anyway, I would also want in that request that they review the Harborview Road and do the assessment and put a proper speed limitation on that road. And I'll make that a motion.
Do we have a seconder for that, please?
Second. Go ahead.
Counselor Long, second the motion. All in favor?
Aye.
Contrary minded, the motion is carried. Thank you.
And that's great. Thank you very much, everyone.
Thank you. Counselor Patterson.
Thank you, Warden. Not so much a concern, but kind of a positive note, I guess. I had an invitation last Saturday to luncheon that the Big Bluff Fire Department sponsored. They haven't had it since COVID. So I walk into the meeting, the restaurant, and there's some of the people I knew, and there was other people I didn't know. I taken back. So I was looking for a place to sit, and I turned to this woman and said, "Are you with the fire department?" "Oh yeah, I just joined." So this influx of people we're getting in our communities, it's just phenomenal what's happening, because some of them are younger people. They're taking over from us older folks, or probably should be out the door there even long before we should. But I mean, it's really gratifying to see that. And I think, Warden, you and I go back when one of the main issues we dealt with was out migration almost 20 years ago. Well, that seems to finally have reversed itself. And, as Danny Graham and Don Mills said in Ingonish, Cape Breton looks like it's going to have a bright future. So that is kind of uplifting, and kind of to see it in your own community. I think that's the best part of it. So anyway, no complaints either. So
very good. Good job, sir. Thank you. Thank you for your comments. Councillor McLeod.
Thank you, Warren. No, just later note to my district, Home Support is doing a Christmas light in December 19 and 20. 4:30, they're going to pick up some seniors, and they're going to go around Bedek and Big Bedek. So get everybody with his lights on in the house, so for the seniors. And that's just wishing everyone a safety holidays and Merry Christmas and Happy New Year for everybody. I think we're not going to see for the community.
Thank you.
Yep.
Councillor McNeil.
Thank you, Warden. I just have one item. I'd like to make a motion that $1,500 be taken from my district budget to the Little Nares Community Developers Association for repairs to the home.
We have a motion on the floor for $1,500. We need a seconder, please.
Second.
Seconded by Councillor McLeod. All in favor? Aye. Contrary minded, motion is carried. Thank you, Councillor. Councillor Longva.
Long-winded one. I had some calls from constituents regarding mostly gravel roads. And I did hear a rumor that there's funding coming to secondary roads, so that could be a good thing. Hopefully it gets spread around here. The Tarryville Road is still not cleaned up from the damage was done by Fiona and the installation of the new bridge. The old bridge is still in the river, needs to be removed before it causes another blockage that could cause problems. And there was land taken from constituents on that road to accommodate the road repair and the bridge. And promises at that time were made to him that it would be cleaned up and reseeded. I see that they have started putting up some guardrails on that road, but there's more needed to replace the Jersey areas that are still there. I've had numerous complaints from constituents on Meadow Road who were extremely worried as winter is approaching and the bridge at the bottom of the hill on the blue side, East Cove end of the road. The road's often icy and slippery and there's no guardrail to stop the engine going on the side of that bridge. Long Hill Road is long overdue for repairs as one side of the road has been compromised. The other side of the road has two big holes in it, which people are forced to hit with their vehicle as it's dangerous to drive on the eroded and undermined side of the road. As I drove up here this morning, I saw that there's a place on the top of the Englishtown Road that floods. I know for sure last year and this year, it's floods, then it freezes, and it's extremely dangerous. It's a high traffic road, especially this time of year with the holidays coming. I had a call from a constituent on the Big Harbor Road that they were thankful for repairs that were done, but there was ditching to be done on the west side of the hill, and it was not. And as a result of it not being done, the heavy rain the next day washed out part of the road, made a huge rut, which is getting bigger with each rainfall. If not looked to as soon as possible, the road will be impassable for any vehicles, and those constituents are worried that if there was any emergencies that they would not be able to reach them. And also on Tiernan and Og Road in Bedeck Bay, they need gravel for the shoulder of the road. And I believe that's it. Thank you.
Thank you, Counselor. Just before I go into my district, I should have mentioned we had a committee of the whole meeting this morning, and we had some in-camera. We should probably approve those minutes. You're the chair, and the recommendations that came out of that in-camera session. Sorry.
Yeah, the committee of the whole meeting, there was recommendations made. I guess we need a move to accept those recommendations as presented during the committee of the whole meeting.
Do we have a seconder? Thank you. Do we have a seconder for that, please? Second by Councillor McLeod. All in favor?
Aye.
Motion opposed, motion's carried. I just have a couple of quick comments and a couple of quick motions. Last Thursday night down at the Macaulay Convention Center, the Waterfront Bedeck did a public presentation on what their vision for the waterfront boardwalk area was. It was extremely well attended, and the messaging was excellent. The presentation was excellent. So I'd just like to send them a quick note acknowledging that A, the work they've done, and B, congratulate them on an excellent presentation. I guess I should put that in the form of a motion.
Motion on the table. We have a seconder for that motion. Second by Counselor McNeil. All in favor? Contrary minded? Motion passed.
And just in reference to your comments about the money coming for secondary roads, it was in Friday or Saturday's Herald. It's $4 million across the province. I think we should write the province of Department of Public Works and ask what their priorities are for Victoria County with our portion of that funding. I'd like to make that a motion.
The motion, we have a seconder for that motion? Second by Counselor Longpa. All in favor? Contrary minded? Motion passed.
Thank you. And in this summer, particularly July and August, the buses are coming up here to they disembark passengers on the main street, which is great. We want those buses. It creates a bit of a traffic hazard, particularly if they're parked at an intersection up here or really anywhere along the town, and it could create problems for the fire department if they're trying to get through. So I'm just wondering if I'd like to make a motion that we write the school board and ask if those buses could be parked in their parking lot during July and August while the visitors are visiting around town, and then could be picked up at a convenient time so that the bus is not there during particularly July and August or high traffic volume times anyway. So if we could write the school board and see if that's an option.
We have a motion on the table. We have a seconder for that motion. Second by Counselor McLeod. All in favor? Contrary minded? Motion passed.
Thank you. And lastly, the province of Nova Scotia presented their climate change plans for the next number of years. I was approached and was asked if I would bring this forward to council, that just with the climate change and try to get less reliance on motorized vehicles, could the village of Bedeque be considered for a pilot project to have electric vehicles be used within the confines of the village? So that would be golf carts and those types of things. Would they be permitted for that use? And we don't have any taxis. We don't have other Uber. I don't think we have alternate routes for people to travel around. So this would maybe a way that people could use these, and they would create less pollution too. So I'd like a copy of that letter to go to the Minister of Public Works and the Minister of Environment for consideration. I'd like to make that a motion.
Motion on the table. Do we have a seconder for that motion? Second by Counselor Oregon. All in favor? Contrary minded?
And the
Motion
last,
passed.
thank you for that. And the last two things don't require motion, but the deputy warden wrote a very good email around in regards to the amount of time and effort he has to spend with a lot of other councillors around provincial issues, particularly around the road. So I'd like your permission to send that to the NSFM because it absolutely captures. I think you said 41 phone calls, 21 emails like that. We have to send that up the line because they are not our responsibility, but yet we're besieged, and it's perfect. And especially if work is not done. So if you're okay with that, I would just like your,
Yep.
yeah,
No
it was
problem at all.
very well written. And the last thing I just want to mention is that last week we finalized our accessibility plan. It's been circulated to you. It is in draft form. It is, in my opinion, 99% done. I would like to have a motion that we adopt that accessibility plan in principle. And that if that's meets the wishes of council.
So move. Gordon.
Oh, thank you. Oh, sorry.
Moved by Counselor Patterson, seconded by Counselor McNeil. All in favor? Contrary minded? Motion passed.
That's it for me. Sorry, I had a long list today, so. We've dealt with district concerns. Are there any notice of motions tonight? Hearing none, we have a road name change petition.
We do. Yes, so we received a road name petition related to a road that currently is named 5606 Road, and it is in New Haven. The proposed name for that road is Rose Way. The second choice of new road name would be Rose Hill. We have a signature from 4 different residents on that road, and I'm assuming that makes up the 2/3 that we require. So would like to make a motion to change road name 5606 Road to Roseway Road.
I'll second
Roseway.
that. Roseway. She was making a motion.
She can't make the motion.
Do you want me to read it or?
No, we just need you to say.
Oh, I
move
move
the
that
mo-
we do the name change to Roseway.
Perfect. Do we have a seconder for that, please? Second by Deputy Warden, all in favor? Contrary minded, motion's carried. Any correspondence? It's been distributed.
All correspondence has been distributed.
Any
and all
questions?
Has been sent.
I'll send any questions about the correspondence you received. Thank you. Yes, sir.
Just wondering, back in the summer, we met at Smoky and we did a thing about the Cabot Trail. Just wondering, did you ever get any responses back from those letters or not a word, eh? Okay, we'll follow up. Thank you very much.
Dan has been in a lot of discussions lately with Destination Canada and Tourism Nova Scotia and several different initiatives. So I know that he's keeping it front and center. So you will be hearing some more things on it, but there was no responses to letters.
Regards to the anniversary. Yeah. It's in regards to the anniversary of the trail. Yes, just for those that, yeah. Councillor Patterson, you wanted a few minutes to,
Just before that.
oh, sorry.
Can I do just a committee report before Councilor Patterson? Can you, and that way we finish.
Yes, and if it's okay with you, Councillor Patterson, any other committee reports?
Right.
Committee reports, sure, go ahead.
Yeah, just to put in the minutes, we meet today for Victoria County Transit. And we are aware of our bus in North is out of order until the transmission is fixed. They say approximately 2 weeks. And we are looking for some funding just to, if we can purchase something else in the meantime. So we know what is the problem and we are trying our best to have the service for North not too bad. Thank you. And senior safety senior committee is going to meet in January the 4th at 2 o'clock. January, sorry. Thanks.
Thank you, Councillor. I appreciate the update. Any other committee updates before? Just wasn't on our agenda and I should have picked up on that. So we're good. We'll turn it over to you, Councillor Patterson.
Thank you, Warden. First of all, I'd like to apologize. I didn't get this report in a polished form. It's kind of scattered all over the place that I can read. So I mentioned to Steph earlier, I'll try to get it out as soon as possible. I'd like to first of all thank council for their support in allowing me to attend advocacy days in Ottawa last week. There were over 100 municipal elected officials there from across the country. The Nova Scotia contingent composed of Mayor Savage from HRM, Lindell Smith, the councillor from HRM, Christine Blair, the mayor of Colchester, Deputy Mayor Jeff Stewart, who was also the FCM second vice president, Paula Huntley from Kentville, Norville Mitchell from East Hants, Juanita Spencer was there, and Mayor Beaton, Mayor Chisholm Beaton, and myself from Cape Breton. So I had a meeting with our MP on Monday, Jaime Batiste, and I'll just give you the rough what we discussed. One of the things, of course, that was brought up a number of times, and you'll hear about it later on too, is a major issue is the RCMP retroactive pay. I brought him up to speed on that, and he was going to talk to the minister, I believe, about it. There was also a discussion about applications and about the ECOA application. There was some miscommunication or confusion, I guess, who to contact, and I think that's been ironed out. We also talked about the aftermath of Fiona, or during Fiona, when the phone service wasn't working and the cell service was not working. And I suggested to him, and I think they are doing this, that apparently the CRTC has had recommendations to improve these situations and they're not doing anything with them. So I mentioned that to him. We talked a little bit about the courthouse. We also talked about a little bit about the rink. And he assured me that that was one of his top priorities, a rink in Victoria County. He said, and as the line was used before we heard, we would be the only county, you know, I don't know, the country or whatever, not to have a hockey rink or a rink. So he's very, very, very much behind that, I think. I did mention coastal protection, Councilor Organ, although it's a provincial issue, just to make him aware of it, and also our issue with how much land is already tied up or protected or whatever, that those are things there. As I was leaving, he asked me about the boundaries, the electoral boundaries, the federal boundaries, which I admittedly, I wasn't that up on because it doesn't affect Victoria County, but it does affect Sydney, Victoria, the whole riding, and Quebec and Highlands Council, which is going to go to Antigonish now, apparently. And he said that originally they were going to leave them alone. There were going to be no changes, but then he said changes were made. So they're kind of concerned about, because, you know, the differences between Antigonish and Glace Bay is coming out of Highlands Council and going to Sydney, Victoria. So anyway, we had a discussion on that. There was an infrastructure forum on Tuesday, I guess, and I'll just briefly mention four things here. They're lobbying to have the Canada Community Building Fund, formerly known as the gas tax, doubled again. It's been doubled in the last few years, and they're looking to have it doubled again. Disaster Mitigation and Adaptation Fund, and I think that was mentioned this morning when we talked about the national, I forget the name of it, assessment fund or whatever, just that was released last week. They're talking about $1 billion annually. Wastewater and infrastructure, water and infrastructure, because a lot of the programs are expiring this year and next year, so they're looking at renewing those. The Permanent Public Transit Fund, which we discussed earlier this morning too, and broadband for hard to reach areas and so on. So that's in the works too. Those are things that were mentioned there. I also spoke briefly to Minister Dominic LeBlanc, and just introduced myself, told him where I was from and so on. He's from Moncton. I think he's kind of familiar with this. So, but anyway, he said that this is from the government side, that a decision on the RCMP retroactive pay would be coming in the near future. So we're kind of hanging out for that. We also met with 3 members of the Conservative Party of Canada caucus on public safety. And there they mentioned with the RCMP retroactive pay, and once that is settled, beyond having a national conversation on policing in the country, you know, it's no secret that Port-au-Pic, there were some deficiencies recognized there. And, you know, as a country, we have to make some decisions about how we are going to be policed. There was also an interesting session on harassment of elected officials. Some people have had their children, I wouldn't say so much threatened, but probably more bullied. Other people have had their houses surveilled by people, you know, they don't mean them well, I guess is what I could say. It's very interesting. And we had, you know, we think it might not happen here. It happened to Mayor McDougall over the great issue of the Christmas parade. You know, I mean, so we have to be aware that the world has changed dramatically. And this is an issue that's spread right across the country. The National Adaptation Strategy I mentioned earlier, and the other one too, and I mentioned this to Alex earlier, the Green Municipal Fund, and there's just two things on it. It may be helpful for the courthouse because they can give grants and loans totaling $5 million for capital projects, they're called. And I was talking to the lady in charge, and I said, would the courthouse qualify? And she said, well, it possibly could. The other one is who can apply, and I wasn't quite sure, but it says right here, Canadian municipal governments, of course, but municipal project partners, including private sector entry and entities, non-government and indigenous communities, among others. So we are considered, I'm assuming we are considered a partner in the ring since we've contributed money to, or are going to contribute money, and they may be able to apply under their auspices for this too. So those things might be helpful. I guess that's about it. Just the final thing, I guess we did go to question period one day, and I taught junior high for 30 some years, and I never saw the behavior in the classroom that you see in the House of Commons. And I'll leave it at that. Thank you.
Thank you. You could have sent a few of them to the principal's office. I guess
Well,
that's what you.
Funny you should say that. The speaker threatened a couple of times, say, if you if you keep on heckling, I'm going to have to put you out. He never did.
Well, it makes you appreciate the forum that we work in. Was there any questions of anybody online that was watching virtually? Our next meeting is on no questions online. Our next council meeting is scheduled for January 9th. It will be at 2 p.m. It will be here unless somebody wishes to have council in their district. And with that, before we sign off, on behalf of council, we want to wish everybody in the municipality the season's greetings and a happy holiday, and extend that to folks around the table and in the building as well. So happy holidays.
Yeah.
We have a motion to adjourn. We have several motions to adjourn. Deputy Warden and Councillor McNeil have both made a motion to adjourn, so I'll let Steph pick between those two, and we are adjourned.